Anisha, Sonia, and Natasha from Springs Aesthetics, and today we are going over microneedling with the SkinPen. So prior to this video, we did numb Natasha for about 30 minutes. You would come in and we would numb you for 30 minutes also. What she's doing is she's just wiping off the numbing. And are you ready to go?
Yes.
Yeah? How does the numbing feel?
I'm completely numb.
Yeah, so you don't feel nothing?
I don't feel anything.
Yeah. So our numbing is pretty, like really great numbing. So you won't feel anything. So, all right, you ready?
Correct.
All right. And then also, the month of November is 15% off of our microneedling with the SkinPen. So we have some great deals, some great things to show you, and we're excited. So here we go. So the cool thing about SkinPen is we can kind of change the dial. So from 0.25 to 0.75, the needle depth, we are actually reaching the epidermis, which is great for the mild scars and the skin rejuvenation. And the epidermis is where the pigment cells live. And then when we go a little bit higher to like the cheeks, we're going to go about 1 millimeter to 2 millimeters of the needle depth. And with that, that is awesome because that is reaching the deep dermis, which is going to really attack all those scars, so which is great for acne scarring and for some of those deep pivots in your skin.
How does that work, Anisha?
Yeah, so I kind of have a little map here for the face. So we always go a little bit thicker with the needle sizing, like in the cheeks and down here on the chin. We go a little bit thinner just because it is thinner skin on the forehead and kind of around the temples. What is great is we also could do not only the face, we could do the neck, we could do hands, we could do the back, stomach. It's great for stretch marks. It's great for hyperpigmentation, acne scars. It's a lot of great cool things that we can fix just here with the SkinPen.
How does it fix a scar?
So how it's going to fix the scar is it's going to go deep down into either the dermis or the epidermis, just depending on what layer and the depthness of the needle here and the cartridge. And it kind of just reproduces collagen, elastin. It's really great. So Tosh, how are you feeling?
I feel great. It's just vibrations.
So you're not feeling any pain? Nothing? Nope. Awesome. So for this, we recommend 3 to 6 treatments, usually about a month apart. And we say this because it gives your skin plenty of time to heal with the collagen because it's reproducing new one, and also with the elastin. How's it feel right there? Feeling good?
Fine.
Nothing? Wow. Numbing is great. Like, it feels awesome. You don't feel a thing. Sonia?
Yeah, she's getting a little bit of erythema here, which is completely normal. She has very nice skin to start with. No scarring or anything on the forehead, so this is going to be really skin rejuvenating for her. She's just going to have a really nice, healthy glow at her skin once it heals. And yeah, we're just getting it to the point where we just see a little bit of erythema. We don't need to make her, really bleed or anything for the skin type that she has.
Okay. Yes, this is great. It's turning over the cellular turnover. Mm-hmm. It is remodeling the scar tissue that if she did have, which I believe you had a few little things. It's great for the masking. Now that's a big thing. It's awesome. You had some, right, Natasha?
Yes.
Yeah, she had some. This is going to clear it up. It's going to be awesome. I can't wait to see her results. Mm-hmm. And then what number are you on right now, Sonia?
We were on a 0.25 on her forehead.
Nice.
Now we're going to go down to the temple area. We'll stay about that right there, and then as we move down, we'll increase the depth.
Nice. Yep, so you are following the SkinPen chart, which is awesome.
What makes it so you can increase the depth?
The depth of the needle, the penetration, how deep we go, and she has obviously more fatty tissue down here. The forehead is more bony, so we want to treat at a lower depth up here than we would down in here. And if this is her area where she has any scarring or texture issues, that's where we're going to turn it up a little bit more.
And then also with the
that's kind of what
cartilage.
this looks like.
Yeah. It's pretty cool because we could turn it. We can kind of, can you turn it a little bit so that way they can see the
Yeah.
needle going up and down?
And then you just do it in sections on the face.
Yeah, one section at a time. And again, it depends on what we're treating for. If someone has acne scars, then obviously we're going to really focus on getting into that scar with a little bit deeper depth than somebody that has more of a smooth texture to their skin.
Right.
So just in case if you guys are just tuning in, we are doing SkinPen with Microneedling. Our packages are 15% off this month. It's great. So, oh, here's Dr. B.
Got Dr. Burroughs.
Hey everyone, so how's our treatment going?
Really good.
Good. So they talked about the nice things you can do with the microneedling. When you need more aggressive improvements, we have our Morpheus, which is very advanced, and it delivers energy through these pins that come out, and we can adjust the depth up to 4 millimeters, and actually the energy goes down to 5. So you can do it anywhere from 2 millimeters down to 5 millimeters depth. So it basically starts where the micro pen stops. And because energy is going through this, you can shrink areas of fat you don't want, like the jowls, or if you have prominent nasolabial folds, or the parentheses as we call them, you can shrink on the outside of them so it pulls them. You can also treat the upper neck with it. And it also does resurface the skin. So if you have uneven pigment across the face, it'll help with that. And it can help with wrinkles and by tightening the skin. So it's fantastic. We've also had great success with the Morpheus for patients with acne or chickenpox scars and things of that nature. So I just wanted to share the difference. And we have this, which is really nice. And then we have the more advanced, deeper treatment that you can do with the Morpheus.
And Dr. Burroughs, can you do that? You can do that on the body too, right?
Yes, and I think we're the first in Southern Colorado now going to have the Morpheus 8, which is bigger than this handpiece, and the energy can go all the way down to 8 millimeters. So you wouldn't do 8 millimeters in the face, but if you're trying to tighten up tissues in the belly or above the kneecaps, areas of cellulite you don't like, skin, upper chest area, that's where the larger handpiece is going to be very, very important and useful.
Awesome.
Well, everybody have a great day.
Thank you. That was awesome. Yeah. So if you're just tuning in, that was a great kind of difference of from ours to his. Ours still goes pretty deep though. Pretty good, pretty deep for the face. Like I said, his is really good. Like you said, for the 8, which would be great for other body parts. This is great too. But if you just kind of want something a little bit more powerful, his would be a little bit more on the side you're looking for. So, how are you feeling? Are you still feeling anything? Or
Just vibration.
yeah, that's awesome. And like I said, this is great for all skin tones, types, great for oversized pores, hyperpigmentation, scars, stretch marks, anything that pretty much you don't like on your skin. We could fix it. We could remove it. We'll figure it out. And if it's not something that a SkinPen can't do, I'm sure we have it here, and we can do it for you.
So it doesn't matter if it's light, if they're light or dark skin.
Nope, it doesn't
Anybody
matter
can
if
do it.
we use it on any of the Fitzpatricks. I'm about a 5. It works great on my skin. I'm about a 3. So it works for any Fitzpatrick, which is great, which we really, really do like, because if you're like on the darker side like myself, you're not going to scar, which is great, because I know that is a big thing for me. I like to make sure it's not going to leave me any scarring or leave any more damage than what I have. So this is a really great pin to use. And Sonia, do you have anything else to offer or to say?
Well, I apply this gel product here just to make the slide of the device a little bit better. So it will glide on her skin really well. And as you can see, she's comfortable. Right, Tasha? Yep. And she's getting that, mild erythema, which is what we want for her in particular.
So it's not like a special serum on the skin, it's just to glide it?
It's a gliding serum made by the company to help you just, and it also feels kind of cooling to the skin as well. Yeah.
You feeling alright, Tasha?
Yeah, that little spot right there felt like I had to sneeze.
Oh yeah, it does that too.
Yeah. Sometimes above the lip can be a little bit more sensitive, that area, but hopefully not much with her. She does have a little pinpoint bleeding right here, as you can see, and that's okay. You will get that in certain areas.
Yep, normal. You're gonna be a great treatment. You're gonna love it.
She'll be back for more.
Yeah. So speaking of more, so anywhere from, we recommend 3 to 6 treatments, just depending on what your end goal is and kind of what we're starting with. For Natasha here, we are going to do it a month from today again, for her second treatment. And I think she's really going to love it. She's really going to see it's going to produce new collagen. She's going to be glowing. It's just going to be like that fresh layer. Because I don't know if you guys know this, but every year from the day that we are born, we lose 1% of collagen each year. Nice. So it's kind of, it's just only 1%, but it's a lot. And it's really hard if you don't have the tools to produce the collagen again. That's what's going to cause the fine lines. That's what's going to cause your skin to look really dull and heavy looking. You're not going to have that shine. So SkinPen is really great for collagen and elastin.
Does it produce more collagen if you do it with PRP? And can you do it with PRP?
Yeah, so we can do a PRP. I don't know if you guys know what PRP is, but it's platelet-rich plasma. And so what it's doing is you use your own body. So we're going to draw your blood. We do that here in the office. And we take your blood, we spin it, and then what we kind of do is we kind of do it like a little facial, and we put it on after, because what it's going to do is it's going to enhance your speed to heal. It's going to use your own body, naturally fluids, to actually really make your skin glow. The collagen is going to boost faster. The elastin is going to grow faster. So it's really great. We do have the offer to do the PRP. And if that's something you're looking more towards, I think that would be a great choice too. What do you think about it, Sonia, with the PRP?
Yeah, it's really going to speed up that healing process, for sure. Something I wanted to mention is for those ladies that, have the little smoker lines, we'll call them, this treatment really, I can target in on those smoker lines and really work on those. Or some people with the crow's feet, that's also a good area to soften up with the microneedling. So anywhere you have something that bothers you, we can most likely microneedle it. So you'll get improvement each time with each treatment.
Nice.
Yeah. Does the PRP help collagen produce faster or more, or how does that work?
It's a little bit of both, kind of. So what it's going to do is, like I said, you're using your own body. So it's going to reproduce the collagen and the elastin so much faster. It's going to be a quick turnover with your cells. And like I said, you're really going to use your own body's natural to really just turn it over, and you'll be glowing. It's your body's natural way of showing how you glow. And we also, like I said, we also offer different products that help along with the microneedling. But if you're looking for something, if you want to go a little bit more natural, I would say the PRP for sure is a little bit more on the natural side to go. So what is your cartridge? What millimeter are you on right now?
On her cheeks, I am at just about a 1 right in here.
Nice.
Yeah. Then I'll turn it down when I get back to that lip area, back down to like a 0.5 or maybe 0.25, depending. Because she did get a little bit of, pinpoint bleeding here, which is perfectly normal. I'm working on the nose. It'll go way down. You kind of have to flatten the nose out, but it's good to help shrink those pores on the nose and
Yeah, awesome for the oversized
yeah.
pores. Yeah.
So it does that. It'll get rid of oversized pores
It
on
does,
the
yeah,
nose.
yep. And then like she said, it does. We go a little bit lower on the needle depth, which is great on the nose because it is a little bit thinner. It is cartilage. And then it does, like she mentioned, like Tosh mentioned, it will make you kind of feel like you have to sneeze. It's a funny feeling. Other than that, like you really don't feel anything. Are you feeling anything now, or no? See, she seems pretty relaxed and calm. Yeah, that's really great. So like I said, we recommend 3 to 6 treatments spaced out anywhere from a month to 6 weeks. This gives your skin plenty of time to heal. So in about a month, Tosh will have another treatment, and which is great because it's 50% off all of our packages this month for this month of November. And it's great for the holiday season coming up, so you'll be picture ready, you'll be nice and smooth, you'll have clear skin, you'll be glowing. Your pictures are gonna look fabulous.
I think it's also nice to give as a gift, you know?
Yeah, you could do that too, yeah.
It's a gift that you could get for Christmas.
Definitely.
You buy it now, so.
Any age, any skin color, Fitzpatrick, it is awesome for anybody and everybody. I would highly recommend doing this treatment at least once in your lifetime, so you can kind of see. It's one of those things where you have to see it to believe it. So this would be a great time to come in and get your special.
She's gonna kind of feel like she has a sunburn afterwards once her numbing cream wears off.
Yeah. Just like a little sunburn, nothing too crazy. We just recommend like no like heavy exercising, anything to kind of make your temperature get a little bit hot, because it is going to kind of make you feel a little bit warmer, and it's gonna, because it is a little sensitive as it is. So at least for 24 hours. And then we also recommend no hot tubs, saunas, anything with like hot water, no big pools that carry lots of bacteria, just because we are creating little microchannels in her skin and we don't want to get any infections. So, nice. Are you working on the nose now?
Yep. Can work on her nose.
Perfect. So what millimeter are you?
I'm gonna go down to a 0.25 on her nose,
Yeah,
and
great choice.
probably gonna be a little ticklish on the nose. Yep. Just gonna give her a little gel here to rub around up on the nose.
Nice.
So her pores will really benefit on her nose from this treatment. So I just go to my little dial and turn it down to that almost the lowest setting you can go. Then I just press the nose over. I kind of try to keep moving the nose a little bit just to distract her, because the vibration is not super fun. But we can get through it.
Does it get to sneeze yet?
Yes.
Yeah. Just do a little massage in between there to distract her.
Work the sneezes out.
Yeah. But luckily we don't have to go over it too much.
Yeah.
Yeah.
So after, it's going to feel, about 72 hours after Tosh, you're going to feel some tingles still. It's going to feel like it can chill a little bit. You're going to have some redness, which is normal, totally normal. And like I said, you have to stay away from anything that has lots of bacteria and hot waters. Like I said, no pools, saunas, hot tubs, anything like that, okay? Alright.
You said it's good for scarring and stuff. How does it handle wrinkles, like for older people who might have more wrinkles than Tasha, young Tasha does?
So the cool thing about it is any age, it works on any age, right? And like I said, at any Fitzpatrick, which is awesome. So with wrinkles, it's going to really help with the collagen and the elastin. So what it's going to do is the collagen, think of it as like a fluffer, right? It's going to fluff it up, whereas the elastin is going to kind of smooth it out and spread. How you like to say it? Spreads the love, right? Spreads the love, and it helps with the wrinkles. So it's really great for more matured skin too. Even if you have from fine lines all the way to the deep wrinkles, don't think that this treatment cannot work for you, because it really does. It's 100% going to use your collagen and your elastin, and you're going to get something out of it. I promise you. I promise. So what are you doing now, Sonia? You're just
I'm
going
just
over?
kind of going back over some areas where it looks like maybe I didn't spend enough time in those areas. Did we numb her eyelids? I don't recall.
No.
So we can treat the eyelids up to this part, below the brow, because the skin does get crepey up there. And if we get the crepiness under the eye, we just pull it down as far as we can work around the eye area. But yeah, we're just kind of going back over a few little areas that we could do a little extra love.
Yeah, and then in Tasha's case, she really wasn't concerned about, her eyes or underneath her eyes. It was mostly just for that masking, which is great. So you hit the chin and you hit the cheeks and the nose pretty good, which is great. That's the main concern. Yeah. So, and then it feels like I said, in 72 hours, she's gonna feel some tightening, some pulling. It's gonna be really dry, which is great. Which reminds me, we will send you home in a little box. It is a recovery balm. And what it's going to do is you will just pat it on for the first 24 hours. If you are going to lose some water in your skin. And so that's going to help with just rehydrating the skin. Because like I said, it is reproducing collagen and elastin. And
Awesome.
are you done?
Yeah.
Yeah? Oh, nice. So how was it? How do you feel?
I feel good.
Yeah?
I mean, I'm numb.
Yeah, you're numb. You don't feel
I
nothing?
don't feel anything.
So a little bit of redness. It looks worse than what it really is, but I mean, she got a great treatment in. A little bit of bleeding, which is totally normal.
Spots, yep.
Mm-hmm.
We can work down on the neck. We can do the décolleté. We can do the top of the hands, above the knees. There's all areas of the body that we can treat.
Back,
so,
stomach, anything. You have it. We could do it. So 15% off our packages in the month of November. You could either buy it for someone or you could treat yourself, like an early holiday gift.
Treat yourself.
Yeah. And then, anything else you guys have to say? No?
Got it covered.
Yeah, if you have any questions or comments or concerns, please feel free to call us here at the office, and we'd be happy to help. Thank you. Thanks for watching. Have a good one.
Bye.